We now begin Section 3 of this program. And the next segment, Dr. May Post answers frequently asked questions about HTSP.
In your introduction to this program, you mentioned timing and spacing. What is the difference between timing and spacing?
Good question. We want a woman to time her pregnancy at the best age possible for the healthiest outcomes. That means to avoid becoming pregnant before age 18 or after age 34 when the risks increase. Spacing, on the other hand, refers to the interval a woman should wait after a live birth, an induced abortion, or a miscarriage before attempting to get pregnant again.
Can families who practice healthy timing and spacing of pregnancy still have a lot of children?
Oh yes, it depends on a woman's fertility intention. HTSP is about healthy fertility, the healthiest time to become pregnant for the healthiest results. For example, when a woman has less complications during pregnancy and childbirth, she is better able to care for her baby and will have healthier subsequent pregnancies. Similarly, for the baby, with a healthy pregnancy with no complications, the baby has an increased chance to survive infancy and childhood.
How would you counsel a woman who recently had a stillbirth?
Well, as you can imagine, counseling a woman who has had a stillbirth and asking her to space is quite difficult. But as health providers, we need to give them the information so that they have informed choice about the benefits of spacing and the risks of closely spaced pregnancies. The current recommendation is to wait at least 6 months after a stillbirth before attempting the next pregnancy, because studies show that if a preceding pregnancy ends in a stillbirth, there is an increased risk that the next pregnancy will also end in a stillbirth. It is also important for the health provider to follow up the woman so that she has increased access to antenatal care in the event when she becomes pregnant, as well as skilled delivery services.
Will it cost more to integrate healthy timing and spacing into existing programs?
No, it will not cost much more to add HTSP into ongoing and existing programs and activities. For example, most countries already have pre-service trainings and ongoing refresher in-service trainings. You can easily add HTSP recommendations into those trainings, not only for family planning service providers, but also for MCH providers, PMTCT providers, and counseling and testing providers, so that your HTSP messages reach not only clients attending family planning services, but those attending MCH services and other non-family planning services. You can also very easily add HTSP into non-health events like community mobilization activities, youth activities, etc.
How do you make sure that HTSP messages are integrated into these existing programs?
At the policy level, you need advocacy. That is, taking the evidence, the HTSP evidence, to decision makers to raise their awareness about HTSP benefits so that HTSP recommendations are included in national health policies, health plans, and frameworks. At the service delivery level, behavior change communication is important. That involves effective counseling by trained health providers, about the benefits of spacing and the risks of closely spaced pregnancies. Also, at the service delivery level, you need community-based distribution. That is, community-based distribution of family planning methods, including but not limited to condoms, pills, injectables, so that clients who are interested in methods can access them at the community rather than having to go to a health facility, which sometimes, with transportation, that serves as a barrier for a client who is interested in having a method. And last but not least, at the service delivery level, you need to make sure that there is contraceptive security, that there is a steady supply of contraceptives, including long-acting and permanent methods. The community level is also very important, and this would include capacity building of community-based organizations, as well as involvement and participation by the community, such as community leaders, religious leaders, in-laws, husbands, so that they buy into the concept of HTSP and family planning.
What behavior change would you want to see in those receiving HTSP messages?
After hearing HTSP messages and understanding the benefits of HTSP, we would like to see certain changes in behavior, such as first pregnancies delayed until at least 18 years of age, pregnancies spaced at least 24 months following a live birth, and pregnancies spaced at least 6 months after an induced abortion or miscarriage. But having said that, we should always remember that HTSP recommendations always emphasize a woman's fertility intention, because in the end, it is a client's decision.
Dr. Post, thank you for answering these frequently asked questions on healthy timing and spacing of pregnancy. It's really been my pleasure speaking with you.
Thank you. Thanks for giving me the opportunity.
Thank you.
This concludes frequently asked questions. Please use the menu to select the next segment of the program that you would like to view. This concludes the program, How to Educate Clients About the Benefits of Healthy Timing and Spacing of Pregnancy. In the 3 counseling scenarios in this program, health providers in antenatal care and post-miscarriage care and a community outreach worker integrated HTSP messages into client counseling. Each provider gave the HTSP message that was appropriate for her client's situation. Let's review those messages. The HTSP message for the pregnant woman and her husband was, for the health of the mother and baby, wait at least 2 years before trying to become pregnant again. The HTSP message for the woman and her husband after a miscarriage was, for the health of the mother and the baby, wait at least 6 months before trying to become pregnant again. The HTSP message for the adolescent was, for the health of the mother and baby, waited until at least age 18 before trying to become pregnant. We hope this program has increased your understanding of HTSP, its health benefits, and its role in increasing family planning use, especially in conservative settings. We hope that now, after viewing the program and completing practice activities presented by your trainer, you feel better prepared to integrate HTSP messages into your client counseling and education. We hope that doing so will improve your ability to help your clients make informed choices that will improve their health and the health of their children and families. We encourage you to participate in further training or advocacy at community, service provision, and policy levels. Doing so will help ensure that more women and couples can have healthy timing and spacing of pregnancies. Thank you for your participation and interest. For further study and more information, please see the resources that are included with this program and the ESD website. Thank you.